Today we're talking about 3 types of medications that potentially can hurt your kidneys. Stay tuned because we're going to cover medicines that treat acid reflux, arthritis, infectious diseases, and then we're going to touch on some other pills like fluid pills, diabetes medications, and blood pressure pills. Hey everyone, welcome back to the Cooking Doc, where we dish up healthy meals and dish out nutritional advice to keep your body in top shape. Today we're steering away from food and talking about a topic we don't cover very often: medications. We're going to go through 3 medications that may hurt your kidneys. But before we dive in, I want to make something very clear. Very, very clear. You should never stop taking medication without talking to your doctor. I don't want anyone to watch this and say, well, the Cooking Doc said these medications may harm my kidneys and so I stopped them. That's not at all what I'm saying, and I even hesitated recording this video because most of the times these medications are perfectly safe for your kidneys and all doctors understand the risks and benefits when prescribing medications. But it's always important for you to be informed so you can ask your doctor more questions. And I want you to remember this, that any medication at any time can cause kidney problems in the right circumstances. Thanks so much for watching today. I'm Dr. Blake Schuster, I'm a board-certified kidney doctor, and I'm also the Cooking Doc. Everything we talk about here is just information, not medical advice. Make sure you like, subscribe, share, and comment. All right, the first category of medications we're going to cover is antibiotics. Antibiotics are used to treat bacterial infections, and some antibiotics, especially when used for a long time or in high doses, can cause kidney problems. Some of the most common intravenous antibiotics that we use in the hospital, and I use these all the time, medications like gentamicin, vancomycin, zosyn, and even medications in a class of medicines called cephalosporins can cause these kidney problems. Even antibiotics that you may take in the form of a pill for urinary tract infections or skin problems, things like Bactrim, or common antibiotics for ear infections. On rare occasions, those can cause kidney problems. And I'm telling you this because I like all of my patients to be informed. This doesn't mean, though, that you need to be afraid of antibiotics. You know why? Because they rarely cause kidney problems, and they save lots and lots of lives. I mean, millions of lives every single year. Next, let's talk about proton pump inhibitors, or PPIs. PPIs, and that's things like omeprazole, Prilosec, Nexium. There's a lot of them, for example. They're used to treat acid reflux, and they're used to treat heartburn. And the way they work is they inhibit something in the stomach called the hydrogen and potassium pump. And when you don't have as much hydrogen into your stomach, you don't have as much acid. And when you have less acid, you have less acid reflux. And boy, do they work well for some people. They're also very commonly prescribed. How common? Well, in a study from 2018, 8.6% of adults in the United States were estimated to be taking PPIs. In most people, these medications are very safe, but they have been known in some people to cause something called acute kidney injury, and there have been studies that associated them with something called chronic kidney disease. I've seen both of these effects during my career as a nephrologist, but not very often. And I almost never have to take a patient off these medicines because I am so worried about the damage they're causing to their kidneys. So my advice to these people, these are my patients, this is not my advice to you because I'm not your doctor, but my advice to my patients often starts with, do you really need to take the PPI? In many cases, the answer is yes, especially if it's used to do things like prevent bleeding, or to treat an ulcer, or to treat a precancerous lesion in the esophagus, or because the acid reflux is just so bad. In other cases, though, the medication either isn't effective, or my patients think they can manage without it. In those cases, we often try to wean down on the PPI and use diet to help manage acid reflux. So that means giving up or limiting things like fried food and fast foods. And really, you know me, there are a million other reasons to limit those foods anyways. Also consider cutting back on foods that kind of promote acid reflux, things like chocolate and tomato-based sauces, and instead loading up on things like whole grains, bananas, and other high-fiber foods like oatmeal, which may lower your acid reflux symptoms. Lastly, let's discuss something called NSAIDs, or non-steroidal anti-inflammatory medicines. These include over-the-counter medications like ibuprofen and naproxen, or Motrin and Advil. Some commonly prescribed NSAIDs are things like meloxicam or Mobic, Toradol, and Celebrex. And these are great medications for arthritis and inflammation. I typically see older people taking them so they can get through their daily arthritis pain and still enjoy their life, or people taking them when there is an injury and inflammation. They need to lower that. The problem is there is a potential for kidney injury with these drugs. These medications, not only do they decrease the inflammation throughout the body, but they have an influence on the blood flow and the pressures inside the kidneys. So it's important for people with kidney disease to talk to their doctor to see if these medications pose any danger to them. And frankly, it's an individual decision and one that should be made between you and your doctor. This is not a decision that you need to be made, or this is not advice from some random doctor on the internet from South Carolina who also cooks and is talking from his kitchen. Now, before we finish, let's cover a few other important medications. These are some of my absolute favorite medications that I prescribe all the time. These medications are usually good for people with kidney disease or necessary to prescribe in people who have kidney problems. However, if someone is on too high doses or if they have a bad reaction to them, then they can cause more harm than good. It's again an individual decision. They often need to be monitored closely by your doctor, and if you have kidney disease, they should be given under the supervision of a nephrologist like me. So some of these medications that I'm talking about are things like SGLT2 inhibitors like Farxiga and Jardiance. Other medicines called diuretics that make you pee, things like furosemide, Lasix, and hydrochlorothiazide. And other medications called ACE inhibitors or ARBs. These are very common medications that are prescribed for people with kidney disease. Metformin is another medication that is often given to people with diabetes. Now, metformin doesn't cause kidney problems, but sometimes it needs to be stopped when people develop chronic kidney disease and a filtration rate that gets below a certain level. Again, talk to your doctor. Remember, the key takeaways here are to use medications as prescribed and keep an open line of communication with your healthcare provider. Your doctor or nurse practitioner or physician assistant, they're the best resource for managing your medications safely. This is so you know there are a lot of possibilities out there. Thanks so much for joining me today. If you like this video, give me a thumbs up, subscribe to my channel, check out my website, cookingdoc.com, check out my book, The Cooking Doc's Kidney Healthy Cooking, a modern 10-step guide to preventing and managing kidney disease, and I will see you next time.